It is a deadly disease and there is no known cure. The virus can be passed during sexual intercourse with an infected person. Anyone can get it, man or woman.
The official warning in the 1980s was that anyone could catch HIV. In 2013, the tone has changed, but the message is the same. In hospitals in East London, a drive to make HIV testing routine for all.
Thousands of patients pass through National Health Service hospitals like this one in East London every day, and yet very few are tested for HIV. Now, I've just had my bloods taken. I've had them taken on numerous occasions. I've never been tested for HIV simply because it was never routine.
New estimates suggest 1 in 5 with HIV in the UK are unaware of it. And for the doctor spearheading the campaign, catching the virus early is essential.
With an early diagnosis, you get the opportunity of putting someone on treatment and keeping them alive to a near normal life expectancy. Whereas when people are diagnosed late, they can succumb to really awful and very serious illnesses and sometimes die. And it's an entirely preventable problem.
The scheme has high-profile backers, including David Furnish, partner of Elton John.
I get HIV tested every year. It's part of my overall health check. I have full blood work done every year across all the diagnostics and all the parameters, and I think HIV is an important part of that. We've made major medical advancements in the treatments we have at our fingertips, but unfortunately attitudes haven't kept up, and people still feel very heavily stigmatized by being identified with HIV.
All outpatients at hospitals in East London are this week being offered tests, regardless of age, ethnicity or sexuality,
press as hard as you can with your finger,
in an aim to reduce this stigma.
I'm only doing it because it just happened. It's just a coincidence I had to have a blood test.
Good.
And you happen to be here today.
How do you feel about this initiative?
I think it's a really good idea. I think yeah, the more people that take it up, the better. Because the earlier it's diagnosed, the more choices you have about what to do about it.
What we want is for this disease to be treated like things like diabetes and cancer, where if you come to the hospital, routine tests are just done to pick you up, rather than having to motivate for those tests yourself.
The reality of testing is that it is cost effective. It costs £5 or $7.50 to test somebody for HIV. It costs £5,000 to treat somebody with HIV for a year if they're diagnosed early. It can cost up to £500,000 if someone is diagnosed late and they've developed the very serious illnesses associated with HIV/AIDS. Becky Anderson, CNN, London.